partner with the neighborhood to bring the needed healthcare into there. Now, from there, community health centers have been wildly successful in the US, and they provide more care than I think many people are aware of to many, many more people, more types of care. But I believe that they're up to almost 1,400 community health centers today. There's almost 15,000 locations where they're providing care, and they provide some of the best healthcare that the U.S. healthcare system provides at all. It happens through CHCs. Folks can go to a community health center regardless of their ability to pay. Community health centers also have, they're required to have a board, a governing board, which is made up of at least 50% of members of the community where the health center is located. And so this gives them a very unique perspective. Of course, they're funded by the government. They're not not-for-profit entities, but their mission is to understand what the healthcare needs of a community are, and then partner with that community in combination with the federal funds that they receive to provide those facilities, provide that care, provide those people, provide those resources and education.
You spoke a little bit about mission, and to me, that's something that I've always found really distinguishes community health centers from other larger corporate entities within the healthcare environment. I've had the opportunity to work with lots of different CHCs through my career, and certainly find consistently with clinicians or frontline staff or their leadership teams that commitment to the mission and serving the really specific needs of the folks in their community is what is often driving them. You may have a similar perspective, but I wonder also how you think that commitment kind of plays out in terms of how they provide care, how they staff their organization. Is it different? Do they come at it differently?
Yeah, it's a great question. I fully share your belief. I mean, community health centers are some of the most kind of inspiring organizations, certainly in healthcare. I mean, there's lots of nonprofits in healthcare, but not all of them are driven with that, mission to provide care regardless of ability to pay, regardless of who you are. And those are not just words for CHCs, for almost everyone who works in a CHC. That really is their mission. And so if you picture the entire pool of folks that, maybe want to become doctors or want to become nurses or dentists, there's always going to be a certain fraction of them that are not in it for the money, right? They are in it for the mission. They're there to care for people and to be part of people's lives and to really make a difference. Well, a decent fraction of those, go to the best medical schools and get the best training, and they're the brightest minds out there, but they go to CHCs because of that mission. And so that's one of the reasons why the CHCs are so popular and so successful, is because the people there are doing it because they love what they do. I think the other piece about the mission is that the CHCs are tied to the community, as I said, and so they are going to go in the direction that the community needs in terms of, we are having a big problem with getting people to the health center in our community. Maybe it's rural, or maybe it's, not in an area of great public access. Well, the CHC doesn't just say, oh, well, I guess nobody's going to come. No, they go and fix that problem. They know what the needs of the community are. And so the mission is more than just watching people go through the door and trying to provide care. The mission is to try to make the community as healthy as it can be, to try to, mitigate some of the effects, the disparities that arise, from that unequal access to care and resources, et cetera.
Yeah, it's one of the things that, I was saying just a moment ago, working with lots of different community health centers over the years, and each of them is really unique. The programs, the services that they offer are representative and reflecting what the needs of the community are. And to that point that you were just saying, if, transportation is a challenge for the clients that they're trying to serve, they will go about trying to solve that problem. What happens as a result of that I've seen is often to create a program of transportation, they need to get grant dollars. They need to kind of start somewhere. And ultimately, that can become a permanent part of what they deliver and what they provide. But that grant approach, trying and testing new methods, being more comprehensive than maybe their healthcare competitors, as it were, are, to really try and fix those problems, innovate around how they're going to provide care, where they're going to provide care, doing the outreach initiatives directly to folks that don't come into the clinic environment, but rather they take the care to those individuals is another attribute that I think is pretty unique. And you see a lot of innovation from my perspective in the community health center space.
Yeah, I completely agree. I mean, just because of that mission, because of the way that they are funded and their ability to try to get those best possible outcomes, they are, again, some of the most successful and innovative places out there, right? I mean, right from the beginning, community health centers have had to report to the government. So way before, meaningful use and reporting quality measures and everything, community health centers were reporting data on the patients that they were serving, and then pretty quickly after that on the outcomes, the healthcare outcomes of the care that they were delivering. So that's part of their nature, that kind of data-driven, community, informed way of providing healthcare. Very kind of early in the renaissance of primary care in the country, when the concept of a medical home was starting to form out of the American Academy of Pediatrics at first, and then embraced by others. The community health centers were right on board with that. This concept that there's a one-stop shop where you can go and get all of your healthcare needs met or coordinated at the minimum. Community health centers were right on board at the very beginning of that, and that's also part of their power today. You can get your medical care there, but many of them also offer behavioral health care, or dental care, or eye care, or all kinds of other services, assistance with any kinds of other needs that you have around transportation or food insecurity or legal needs, or all kinds of things. And then, as you say, they realize that not everybody is going to be able to come into the clinic, and so they help with transportation needs perhaps, or they go out in a mobile van and they provide healthcare to where people are living. We have examples within our clients of folks providing a truly innovative care in homeless or unhoused patient encampments, because that's where the people are, and so that's where they go, and that's where they deliver care, and they figure it out, and they do a great job.
Indeed, there was a lot of partnership. I'm just reflecting back on the couple years that have passed us with the COVID-19 pandemic, and how much coordination was happening between community health centers and local departments of public health, to when the vaccines became available, or to provide masks and provide education around the transmission of COVID-19. A lot of those community outreach efforts were really staffed by community health centers, because we haven't necessarily maintained the investment in the infrastructure of public health bodies, or it's disparately funded from state to state. And yet community health centers are really foundational now across American communities, and they played a really significant role in the pandemic. And then as the vaccines became available, in doing that direct outreach again and bringing vaccines to individuals that were at high risk and that needed to get them early on. Let's shift our conversation a little bit. You mentioned before outcomes within the community health center environment have been demonstrated to be really quite high quality. I think there's a perception, and it's a bit of a misnomer, that because they're serving a really complex population, or they're serving a population that may not have a lot of financial resources, that somehow the care isn't going to be as good. And yet the data really doesn't show that. It shows the better aspect of that story, which is indeed that community health centers can do a great deal with the resources that they have. Talk a little bit about your research in that area and what you've learned, and how you help tell that story as you're working with NextGen's clients in this space.
Yeah, it's a great question, because if you look at any kind of reasonable measure of patient complexity, of medical complexity, the average adult patient that's being seen in a community health center is more complex than your average adult in the U.S., or even your adult in the U.S. Healthcare system outside of CHCs. And yet there's lots of examples where, on nationally defined quality measures of what it means to provide good diabetes care, or what it means to provide good control of high blood pressure, where CHCs are outperforming the rest of the physician community, the primary care community. And I don't mean outperforming in like a risk adjusted way. I mean just flat out better control of some of those conditions. They also provide more primary care services. In other words, they are up to date with the appropriate wellness and preventive exams or screenings than, again, your average population who does not go into a CHC. And they do this while simultaneously providing high quality care. They do this by actually lowering the overall cost of the system because they provide access and a better place to receive care than the emergency room, which would be the other option for a lot of folks. And so that efficiency ends up being able to be leveraged into a better relationship with the patient or the health center, and then that can get leveraged into better outcomes and lower cost care. So it's a fascinating puzzle to have all of the pieces of how do you handle really complicated people. Well, you try to make sure that they can get their needs met, that they have access, that they have a home, a medical home, and that these services are available. They're not just told to go and get these immunizations or go get this expensive test done. They figure out how to make that happen. I think there's a cultural aspect to this that's also important because CHCs are tied to the neighborhoods where they are. They're able to provide culturally appropriate care in a way that, again, is not necessarily inherent with primary care. There's lots of CHCs that are dealing with 6, 7, 8, 10 languages within their healthcare systems commonly. They will frequently have people who live in those neighborhoods who speak those languages working in the center to help facilitate messaging and communication. Of course, they use translator services and whatnot when that's appropriate. But they also can help frame some of the care that needs to be delivered in a way that folks from different cultures, different experiences, and ways of perceiving healthcare can understand that it's important for them to get that care as well.
Mm-hmm. Where do you see the kind of future of community health centers in the United States? Would you anticipate continued growth and expansion, i.e., more sites, more folks getting care from community health centers and federally qualified health centers? But also, do you foresee these organizations broadening the scope of their clinical services? Or, like we see in other aspects of healthcare, kind of consolidating or becoming more sophisticated delivery systems that are maybe not owning and delivering all of the care themselves, but coordinating that specialty care in a way that's more cost effective, more patient-centered?
Yeah, I mean, I actually see all of those things happening. I mean, certainly the growth of community health centers measured by either the number of patients or the number of sites or whatever has continued to pace, and I would anticipate that it would continue to do so. I think that the centers themselves continuing to expand the types of healthcare that they themselves are able to deliver will also increase because if you already have some of that infrastructure and the connection to the community and you've solved some of the common barriers, then it is more efficient to add this type of specialty service or this type of new healthcare need into that infrastructure than it would be to try to find a specialist that all those people could go to or whatnot. I think the cost pressures on healthcare are obviously ever increasing, and so the fact that you have high quality care that can be delivered in an efficient model, perhaps one of the most efficient models possible, is going to from the outside or the governmental, even the payer sense, continue to exert pressures that CHCs will be able to respond well to, but other organizations who are not necessarily embracing value-based care, with their whole hearts, may struggle with. And my hope is that as more and more people become aware of what community health centers are, what they do, the fact that anybody can go there, and why would you want to go there? What would be an advantage of going there? That those kinds of things end up actually just driving more patients to use the health centers that are out there, right? You don't have to be poor, to be frank, to go to a CHC, right? They will accept you no matter what your insurance situation is. Some people are lucky enough to have, year-round commercial insurance, but lots of people are not, right? They get it through their employer. Their jobs are not stable, or they're seasonal, or they have a huge deductible. And so the fact that CHCs can provide them with lower cost flat out care as part of that deductible, or they may qualify for very low cost medications through some of the programs that CHCs offer. All of these factors are going to bring patients to CHCs, and then that capacity, I believe, will expand to accommodate that. I think CHCs are also becoming more active in the two, highest areas of growth, Medicare Advantage, right, and Medicare ACOs. CMS has plans to take everyone, essentially every Medicaid care patient, off of straight fee-for-service Medicare in the next, depends on when you ask them, 10 years or so. And CHCs are very well positioned to be part of those networks, of those programs. They already are delivering excellent care with data, with quality, and they can prove all of that. And so many of them are already participating in those plans and inviting patients who have that kind of insurance to join them.
Mm-hmm. Are there any kind of final question here? Any headwinds or challenges that you think community health centers are facing that may cause them to stumble or not be able to fulfill that mission that we're talking about, or that future vision?
Yeah, there's a couple. One interesting point that folks certainly may not realize is that community health centers have very broad support on both sides of the political aisle, right? So even though they are serving the underserved, is not a Democrats versus Republican issue at all. So that is not a headwind, interestingly, perhaps compared to some of the other anti-poverty programs that started at the same time, right, in the 60s. I do think that CHCs will need to be better understood by more Americans if they're going to continue to be able to be as successful as they've been, as they become more common or more familiar. I think there's every reason why people should be embracing them in their communities and should be going to them in many cases. But there's a bit of a public relations possible challenge ahead of them.
Mm-hmm.
I think, like lots of areas of medicine, they are having trouble recruiting staff, or will there be enough primary care providers and nurse practitioners and PAs willing to work in a community health center, perhaps under circumstances that would be different than in private practices? Will there be enough of those people around to allow the system to continue to grow? I think is another challenge. But I do think that if they continue to be able to stay on mission and provide this kind of high quality, provable outcomes in care, that there's every reason to hope and to believe that they will be successful.
Yeah. Indeed. They are the answer to the value equation in many ways. And that's been a longstanding goal of government policy for the last decade, as we've seen. So certainly a good opportunity for us to spread the good news of the good work that community health centers doing. My guest today has been Dr. Bob Murry, Chief Medical Officer of NextGen Healthcare. Thanks so much for joining me today and helping tell the wonderful story of community health centers and the role they play in help ensuring access to high-quality, cost-effective care across the United States. With that, good afternoon.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.